Hi, we do another case review today. Her case is a little bit unique. A lot of our patients here, we see chronic pain patient, but her case, to me, is a more acute side of a sciatic problem. So I will call her B. So B, she's a 56 years old and found us through web search. Very unusual because a lot of our patients referred by the orthopedist or rheumatologist or pain management, but she found us through the web search. I think the reason is she's an acute problem, so she was looking for something in her own way. When she came, it's a right side sciatica pain, 8 out of 10. And she had this pain for 3 weeks. She likes ice pack. It's a good clue for us. And she take a prednisone, the steroid as medication. And rest helping her. And then, as I said, the cold pack and actually some hot pack as well. And all the pressure, whatever the pressure, is actually worsening. So she was not a really massage candidate either, because we have a therapist, and then probably she's not a good candidate. And her pain was like she said, a lightning bolt. Whenever she moves, it's like very sharp. And her diagnosis in our view is still because the liver in deficiency and gallbladder deficiency. And I also see some stagnation, because when patients said very sharp and electric shock like pain, it's usually stagnation of blood, and then that creates really severe pain. So when she came, she couldn't really walk. Especially the radiating pain to her leg was really severe. She had this pain for 3 weeks, but she also mentioned she had a pain like 8 years ago. So 8 years ago she has pain, and it was more front and then side of her leg. But right now this one is different part of her body. Total treatment she got was a 6 visit with us. I would say the B's case is it's very unique case because it's acute, and her treatment was only 6 visits. So after 6 visits, she resolved. I mean, she said that her pain is resolved and that she doesn't need any more care, and I totally agree with her. And during the treatment, she couldn't drive at all. So she had to wait for husband to come pick her up. And first and second visit, she couldn't sit on our reception area because pain was so bad when you sit. So she actually stands constantly and then moves around, because it's just standing itself is also bothering her. So she was just walking around the reception area. And she actually left testimonial for how much improvement in short period we accomplished. She came 3 times a week for 2 weeks. So this one was early 2016. And during the treatment, we also added up some special point for her other than just a sciatic point, because she was a little nervous personnel. So we had some couple like head point to calm her down, and some point for balance her like a GI tract. And I think that made some magic on her case. As I mentioned, it's an unusual case because a lot of times this acute patient is hard to think some acupuncture is their option. But she was smart enough, and she was very holistic minded. Even she was taking, there was like a steroid, but she was wanting to try, and then at 6th visit she got so much better. And her age, like 56 years, is typically people having some problems along with their hormone change. Hormone change usually happens around like a 50, age 50, or like a 49, 50, 51, I would say. And body changes a lot of the body make a lot of changes, and then people also having some other unrelated issues. In her case, still she had a little hormone problems, but her pain was, I would say, definitely very successful. Unusual case, but not always unusual for other clinics, because most of the clinic, the acupuncture clinic, is popular for sciatica pain. Her treatment was mostly located at the extremities. So that was her concern. Why you using a lot of extremities point? Even my problem is center, like the legs and the back. But it wasn't really problematic for her, and then we explained, so she was happy. And one thing I noticed in her case, she had so much trouble going up to the bed, because sitting is already uncomfortable. It's a standing one, and then the going up to the bed was such a challenging for her. So in this case, in our office, patient doesn't need it to be actually lay on the bed. They can sit on the chair if they want, because our point is not where your pain site, it's the extremities. So a patient can actually sit on the chair if they prefer. When you go to the acupuncture clinic and then you're afraid, oh my gosh, I cannot lay down on the bed, and then no worries, there's other option. And then probably 1 or 2 patients daily in our office prefer to sit on the chair if they have severe back problems. That's it for now. Bye.